Hi, I'm Claire and I'm a midwife. I've looked after hundreds of women over the last few years, and today we're talking about back pain in pregnancy. I'm pretty sure every woman I've ever looked after has had back pain at some point, so hopefully if you're pregnant you'll find this helpful. So Hayley, how are you?
Yeah, I'm all right. I'm 35 weeks pregnant. This is my second pregnancy. I had hip pain in my first pregnancy as well, and it didn't really go anywhere. It just kind of stayed the same. That was fine, could deal with that. This pregnancy, it started a lot earlier. This whole area is just pain right now. So I've been diagnosed with SPD this time.
And how about you, Becky? When did it start?
Mine started around the 3-month mark. When you rest it, it becomes worse.
Yeah, I get that.
Do you get that as well? It's so strange.
So back pain in pregnancy is really common and it is really normal. That's the most important thing. The things that you need to look out for and you might need to see your GP for are very similar to kind of the symptoms that Hayley's feeling, where she's really struggling kind of getting around and about. So if you have anything that you're worrying, that you're getting any severe pains down your legs, you should just pop to your GP to have a checkup. So SPD or pelvic girdle pain is caused by the hormone relaxin working on your symphysis pubis, which is the part of your pelvis that joins each side together. When you're pregnant, it causes it to become softer and means that your hips can kind of move a little bit more than they would normally. So if you are experiencing any symptoms that are really painful or anything that's concerning you, or you're feeling that you can't actually get about, then you do need to see your GP. So Hayley, did you find anything that helped?
I've been to physio and they gave me a lot of exercises that I can try and do and basically just try and adapt my way of moving. And she also gave me a kind of support belt and that's helped a little bit, but it does make me feel like I'm squashing the baby.
I mean, the pregnancy belts are quite good. Don't worry, you're not gonna squash your baby. So that's fine. But they can be quite uncomfortable, can't they? So some of them are like a massive kind of elasticated bandage, and then you can get other ones that kind of like go around and you strap in sort of thing. So they're quite good and they're quite cheap to buy as well if you do need to buy one and you don't have physio to provide one for you. Have you got one of those pillows that's like a big long L shape?
I have, but it doesn't do anything for me. I've fallen out with my pillows. I've got 5 of them. One of them's a big L shape. I've got 2 normal ones and then a cushion, and I try every night something different just to see if it might work, but haven't found anything that works just yet.
Pain relief, you can take pain relief as well. So things like paracetamol are okay in pregnancy.
Is it? Can you still take like the regular?
Yes, paracetamol you can take exactly as it is on the packet.
Okay.
No ibuprofen or anything like that. You can take codeine-based products, but only if your GP has prescribed them. So I wouldn't recommend that you buy any cocodamol from the pharmacy or anything like that. But you can take paracetamol quite easily. Obviously, it's really cheap.
I also found that essential oils in the bath helped a lot as well. I brought eucalyptus, peppermint, ylang ylang.
Quite important to mention there as well that unless you're trained, you shouldn't necessarily use essential oils during your pregnancy. There's obviously people who are qualified aromatherapists can give you the proper advice, but for starters, you should never use clary sage until you're in labour, frankincense, and you shouldn't use any lavender until after the baby's born. So that's really important to mention. Don't pop to the shop and just think, oh, I'll have that one, because it'll smell nice. Because they do have quite potent effects, and I know some people are quite sceptical, but I've actually seen it firsthand how well they work. So I wouldn't want you to put yourself at risk just for the sake of something smelly. So the clary sage, that can start your labour off. If you're in labour and you're in the early stages of labour, clary sage can also help increase your contractions and keep things going, in the latent phase, as they call it, where it's a bit faffy. You can have irregular contractions, but if you're using that earlier on in your pregnancy, obviously there is a risk that it can cause some early symptoms. Although I would be dubious to think that just a bath with some clary sage would start you off at any point, but I still would just use caution. You don't want to risk anything when you're pregnant, do you really?
So the bath helped me to relax my muscles, almost like soak my muscles, because I'd stay in there for quite a while.
Water's amazing though, isn't it? Especially kind of all the way through your pregnancy.
Yeah, it kind of takes the weight off as well.
Yeah,
that's why swimming's good, isn't it? That's that's fabulous for SPD swimming.
Is it?
Yeah, absolutely amazing. So you don't have to necessarily do like a full, front breaststroke or anything like that. As long as you're in the water, your bump is supported. And if you do like aquanatal, do you have anything like that?
Yeah.
Helping relax your muscles, it keeps you fit, and it kind of helps with all the pains in your pelvis and in your back. So it's fabulous, really.
I'm actually considering having a water birth this time just because of SPD and just to have that weightless kind of feeling. In my last labour, I spent the whole time just walking around, and I'm worried that this time I won't be able to do that because walking is so difficult.
So it is difficult when it comes to the labour part with pelvic pain and back pain and things, because it's not one of those things that when you get into labour goes away.
Yeah.
It can stay the same, but for some people it can be harder. So as long as everything's okay, a water birth is a really good option. You've got to think about your pain relief in labour as well. Most people, everyone's different when it comes to pain relief when they're in labour and during pregnancy, but whatever suits you best. You might find some people find that when they have severe pelvic girdle pain, they do need something a little bit stronger on board. So there's no wrong answer when it comes to pain relief, but you've got to use what suits you, because at the end of the day, it's your comfort, isn't it? And there's no prizes for being brave when you go home. So guys, what do you have that you want to ask me?
I think something that I really struggle with at the moment is travelling. So for example, today, driving a long distance in a car, and it was fine while I was in there, and I had my seat, so it was upright, so it was like a bit more comfortable than kind of leaning backwards. But when I got out, I was literally like an old man.
Yes.
What can I do to help?
I think travel is a difficult one, especially if you are suffering from pelvic girdle pain. I mean, driving wise, you can drive all the way up until you feel that you can't anymore. So there's not like a dead set amount, like 38 weeks, no more driving.
Right.
You can just drive until you feel comfortable or uncomfortable, as the case may be. So just making sure you take lots of breaks if you're driving, try and avoid the long distances driving yourself. But at the same time, just make sure that you're taking care of yourself. A bit of self-care is so important.
With work, do you have any tips for work, like how you can reduce the pain at work, if there's any
I think the most important thing is being upfront with your employer. By law, they have to do a risk assessment frequently during your pregnancy. They should be giving you the adaptations you need so that you can do your job, or give you duties that you can do instead of the ones that you're doing at the moment. They have to make reasonable adjustments. Yeah. Obviously, if that's not happening, and occasionally there are people that do find that they have trouble, making sure that you go to ACAS and things like that. They can help you with your rights and things like that. And there's a lot of information online as well. I think also having a birthing ball is quite helpful. Have you found that?
I found that really, really useful. I go between bouncing on it, and then also I lean forward onto it as well. And I find that really actually takes the weight off my bump. Yeah. I do feel like I'm doing my back a bit of a disservice though, because my back feels like it's doing that. Yeah. But it's really comfy. Yeah. So I'll go between the two.
So do you have any tips or tricks for relieving pain at home?
I think it's really important to utilise what you've got in your house already, rather than going on and having to spend loads of money on weird and wonderful things. Although I would say a ball is the definite purchase. Yeah. But using heat and cold is really important. So obviously don't put too much heat on your tummy. If you're using a hot water bottle, just leave that for your back on its own. When you're in labour and things, heat can be really helpful, but we're not kind of talking about that right now. So nothing too hot, especially on your tummy, just on your back. But you can use ice as well, because that can be really helpful. Ice can be better than heat in some instances. So make sure that you've got you can get the cool packs that you can refreeze, or ice or peas, anything like that, just to pop on your back. There's lots of inexpensive things you can buy, to be honest, but try and see what you've got at home before you shell out the cash, because you're not going to probably want it again. Yeah. Thank you so much, guys, for coming and talking about your pregnancies. So this is the end of the pregnancy back pain video. If you do have any questions that we've not answered, please pop them in the comments below. It is really important to note that if you are feeling that you're in pain, please don't force your body. Make sure that you're taking care of yourself. It's a short period of time that you're pregnant, and you really need to look after yourself. Otherwise, if you have got any questions, pop them in the comments below. If you do want to, you can subscribe to Mumsnet. And if you like this video, please give it the thumbs up. Thank you.